Hey Columbus, Troy here with Ohio Men's Health once again. Welcome back. Hey, today we're going to talk about something I think that is really important for everyone to hear if you're considering testosterone replacement therapy or male HRT. And our topic today is going to be on the three most important things to look for when you are considering testosterone replacement therapy. Number one is that we're results oriented. Number two is safety. Number three is affordability. So before we get started with today's talk, let's let you know how to find us. So you can find us just by a Google search. ColumbusLowT.com goes directly to our website. You can find us on Facebook, Google, Instagram, TikTok, YouTube, just by simply searching for Ohio Men's Health, and our videos go out to all of those outlets. So today, let's just talk a little bit about those three things: results, safety, affordability. So results. When it comes to results, I believe there are four things or a handful of things that we need to consider in order to get you good results. First, we need to meet with you, get a good history, and listen well to what kind of symptoms you may be having, as well as really consider your past medical history. What kind of medical problems have you had? Some men have used steroids in their younger years, testosterone, things like that in the past. So number one, we need to listen. Number two, we need to test thoroughly with an extensive lab draw. And that extensive lab draw allows us to look at all the other potential things that your symptoms may be that might not be low testosterone. So it allows us to look well and then find the problem. So when we do that, we're able to look at your symptoms, we're able to test extensively, then we can put this together and identify ways to begin working with you to get you well. Then along the way, there's a handful of things that are important to get your results. Number one is great communication with your provider, having access to your provider. We're 24/7 access as you work with us. Number two is frequent lab draws. So we need lab draws on intervals, 8 weeks oftentimes, or 3 months, and some time and patience just to kind of see where do things go, how do you feel, and what do we see on labs, and what do you experience, so we can begin modifying things. Injection frequency is also important to get you good results. Sometimes a once-a-week frequency is good for some people, and sometimes a twice-a-week frequency is better for others. So we also need to try to figure out your injection frequency and other potential medicines that may be beneficial, such as estrogen blockers, peptides, pituitary stimulants, things that might keep your testicles moving, like enclomiphene, Clomid, other things that might help get you better results. So those are all things to consider when it comes to getting your results. Now, safety, that's number two. We want results. We want you feeling good. We want you to have energy. We want you to be, motivated, getting into the gym, seeing body composition, all the things you're looking for, good sex lives, all those things. We want to see that. But the most important thing is that we do it safely. And safety is going to come in a few things. Again, good communication with your provider, okay? So really, really good communication with that person. Again, 24/7 access here to us via cell, text, emails. So good communication, frequent visits, and again, frequent lab work. So you might see a little theme here. So frequent lab work allows us to take a look at things and make sure things are safe. We need to look at your red blood cell counts. Are those going up? In some men they do. And we don't want them to go too high, because that could potentially put you at risk for stroke, heart attack, DVT, things like that. So we need to watch the blood counts. We need to check your levels. We need to check your estrogen levels. We need to check your kidneys, your liver. We need to keep an eye on these things. So frequent lab work is really important for safety. And then last and not least, this needs to be affordable. So listen, you can go to every program like this in Columbus, Northeast Ohio, throughout Ohio. Most of us are using pharmacies that are the same. Most of us are using the same medicines across the board. But the thing is affordability. We are $125 all inclusive. That includes your medicines, your syringes, your needles, everything that you need to get the results that you're looking for from all the same pharmacies, for doctors that you might be paying $300-400 a month for, and you're getting the same medicines, same treatment at an affordable rate. So the three things that you really need to consider: results, number one; safety, number two; affordability, number three. So again, if you're looking for us, you can find us, ColumbusLowT.com. You can contact us directly, 330-662-1030. You can call us and or text If you have questions, would like a telephone consultation, initial in-person consultation, laboratory review of the current year program you're on, we'll be happy to see you, and we'll see you next time.